CBD oil is often lauded as a cure-all for whatever ails you, from insomnia to common aches and pains. But finding reliable medical information about how and if it works is a challenge. So Dr. Elaine is here to help us demystify some of the claims. And Elaine, first off, we've addressed this before, but just for clarity, CBD doesn't get you high or give you a buzz like THC does. Am I correct?
You are correct. I mean, since we last spoke about this, we're very clear that there's two components, key components to cannabis, which is THC and CBD. And I know we're going to be focusing on CBD today.
Absolutely. So there's ongoing research into the potential benefits of CBD for certain conditions, but a lot of it is anecdotal information. Currently, what reliable data is there to support its benefits?
Well, interestingly, since we spoke, and I've had some personal experience with dispensing it and prescribing it for my patients, there has been a lot of studies to show, specifically, especially with recreational users, that it's helpful for pain relief, helpful for palliative care to help people address some of their nausea with cancer treatments, musculoskeletal disorders, and especially spasms that people get. And some people are also noticing efficacy using it to decrease their epilepsy, seizure frequencies and severities.
Okay, and that's actually not just anecdotal, that's science showing us that it works in those areas.
That's right.
Okay, we asked our viewers on Facebook and Twitter what they would consider using CBD for, and more than a few mentioned sleep. So can CBD help you get a good night's sleep?
Yes and no, depending on who you are, because sleep, as you know, is very complicated. It's just not as simple as getting you to knock you out. CBD by itself, we know, stimulates a component called GABA in our brain chemicals. And if you have enough of that and you're already quite calm and you can't sleep, it's not going to help you to take more CBD. In fact, what I've noticed with a lot of my patients is that adding a little bit of THC with the CBD actually helps, because I think it also has a little bit of relaxation effect, shall we say, and it helps people sleep.
Quite a few viewers on Facebook brought up arthritis or joint pain. So how can CBD help with that, and what format works best?
Right, so CBD, whether it comes from a cannabis plant or a hemp plant, does show efficacy in reducing inflammation. The challenge is, for many people with arthritis or pain, they need to take quite a high dose of CBD, and it can get very expensive, so oftentimes they get back to their standard drugs and medications. Now, we know it works because we can see that when you put CBD topically on the face for conditions like acne, rosacea, psoriasis, eczema, it does calm down the face, and so we know CBD is an anti-inflammatory.
Interesting. Okay, some of our Facebook viewers are already taking CBD for anxiety, and others said they're really open to trying it. So what do we know about how it works in that area?
CBD triggers a chemical to be produced called GABA. And when you're low in GABA, it can cause you to have less relief around anxiety. So it is a calming, sedating neurotransmitter, and CBD triggers you to make more GABA.
Okay. Really good information. Thank you, Dr. Elaine. I like that we can always go back to the facts with you, because there's so much information out there that we need someone to sort of walk us through it. So thank you for that.